So I'm going to give you a demonstration of how I check people. It's called muscle testing. It's based on Chinese medicine. And this is Darlene. So I'm going to have Darlene raise her arm like this. And she's going to keep her elbows straight, her hand open, and lock this muscle. And see, she cannot hold her arm straight at that point. Push back as hard as you can. She still cannot hold her arm straight. And that's because the nerve flow is going through the body, but she's thinking, hold the arm strong, and that impulse will go to this muscle. And so I can go through a full testing sequence with a patient, and I can tell where their energy is blocked, where their nerve flow is blocked, and then we figure out what we should do about that. I need more information, these energetic vials, and they have different types of energy in them that will either make her body stronger or weaker. So these are different immune challenges, and these are food challenges, and these are chemicals and toxic metals. And that's, again, the energetic aspect of what I do in natural medicine. With Darlene, I'm going to check to see how her organs are doing. Now that's gallbladder. And so I'm going to massage that area and do some deep tissue release here. If you press right between the lower rib and your belly button in that area and you find that it's sore, that's a good indication that your gallbladder is a little bit stressed. If you have a tendency towards diabetes or hypoglycemia, which is when your sugar spikes and drops, spikes and drops, then you can also go over here right where the pancreas is. Push back for me, Darlene. Pancreas is right about here on Darlene's body. You can relax here. Thank you. And so here's the bottom of her rib cage. Spleen is in here, and the pancreas is right here near her waist. And so again, I'm rubbing and just massaging right here, and that helps the pancreas, which is where insulin is produced. And insulin is the hormone that gets released when you have sugar that you eat that then passes through the intestine. And using Darlene's arm, I check to see if it has to do with a nerve reflex right over here. You can bring this arm down. And if it does, then what I do is come over here and give a little release right in her hand and her wrist here. I can also use her fingers to relieve some nerve flow. It's almost like an acupuncture principle, letting the nerve flow back up. Because remember, with gravity and with the limbs and the fingers and toes at the end of the body, nerve flow can get trapped. Another thing that you can check for yourself at home has to do with how well your stomach is working in terms of the digestion and digestive enzymes. So I'm pressing right in here. And you see that reaction from Darlene, which means that she needs more stomach acid. One thing that you can do is use apple cider vinegar, or you can use digestive enzymes that contain betaine hydrochloride so that you raise the stomach acid level. Many people who have what they think is heartburn or acid reflux simply don't have enough hydrochloric acid. There's a corresponding point over here. Is that sore?
Yes.
Okay, that means that Darlene needs more digestive enzymes. And the enzymes actually break down carbohydrates, proteins, and fat. So there are two different types of digestion that are going on. Now, if you get a lot of bloating up here, it may mean that you're not having enough digestive enzymes or hydrochloric acid. And the next thing that happens is the food starts to ferment. The other reason for bloating that's very important has to do with gallbladder. And if you're not breaking down your fats correctly, then you can get bloating down here from your gallbladder. So these are the sorts of things that I look for to help people have that correct digestion and that correct assembly line so that they can get all the nutrients into their body that come from their food.